My client name is Lulu. She is a 40-year-old woman and she has a back pain, so I'm gonna do some exercise to strengthen her back muscle, such as multifidus. And we are doing exercise, back extension concentric exercise. Hello, Lulu.
Hi.
How are you today?
Good, how are you?
So, do you remember me?
Yes.
Mm-hmm.
We saw you last week.
Sure. So today we are doing some exercise to strengthen your back muscle. Since you have pain on your back, so I'm gonna do some exercise to strengthen your muscle and relieve your pain. Is it okay?
Yeah.
Yeah. So during the exercise, you might feel a little pain if you are doing it the wrong way. But don't worry, I will monitor you. So I will make sure you're doing correct exercise.
All right, sounds good.
Okay. So do you have any questions for that?
Nope.
Okay, so are agree with this exercise?
Yep.
Okay. Before the exercise, I'm gonna explain the exercise just briefly. You're just put your hands and your knee down on your mat, and you are just bringing one hand up and the opposite leg at the same time, and you are switching your hands and your leg. Is it clear?
Yep.
Okay. So do you have any questions?
No.
Okay, so since you are a visual and auditory learner, based on your questionnaire you have done before, so I'm going to demonstrate and also with explanation verbally.
All right.
Okay?
All right.
Good. So I already cleared up the area for your safety. And first, you are putting your hands just directly below your shoulder and your knee as well, just directly your hip. And you have to tightening your stomach first and brace. And you should make sure your head and neck and your back should be straight and neutral position. And now you're just bringing your one hands and your leg, opposite leg, and hold it for 5 seconds and put it back. And switching your hands and leg and for 5 seconds and put it back. And in this exercise, you have to make sure strengthen your back and you're not rolling your hips or you're twisting your pelvis. Is that okay? Are you understand this exercise?
Yeah. All right, so it's like that?
Yeah, that's
All right.
good. You have to twist. You don't have to twist your pelvis. You have to stay still in this part. Just you're moving just your hands and leg. Okay. So can you do it?
I think it's a little bit hot. I feel a little bit pain right there. When
Okay.
I bring both arms and a bit like my legs up.
Okay. Then we are modify the exercise so that it makes more easier. Is that okay?
Yeah.
So now, right now, just you're not moving your hands. You're just lifting your leg, just one leg each time.
All right.
Yeah.
Yep, that's much better.
Yeah. In this position, you don't have to lift your leg too high, because you're moving your hip. So
So my pelvis have to be controlled, right?
Yeah, you have to be controlled and still
Okay. I
Yes.
think I can do
have to
that.
string.
Is that okay?
Yeah, that's good.
All right.
You're doing great. And make sure you're not depress your back. You just have to be neutral position. So maybe have to tightening your stomach a little bit. Good. Can you do it one more time? Do you have any pain during the exercise?
No.
Yeah, that's good.
Right.
So how do you feel about this exercise?
Yeah, I feel good.
I think you are doing really great. So can you do this exercise at home?
Yep.
Okay, so you can do this exercise for maybe 12 reps and for 2 sets. And between the exercise, you make sure you break. And also, the important thing for this exercise, you have to still your back. Just make sure. And here's the instruction that you can see. And also it has a picture, so it's really helpful for your exercise when you're going back home.
All right.
Yeah, here's it. Yeah. Do you have any questions for the exercise again?
No, so we do that every day?
No, it's not every day. It's maybe one.
Every
Each
every
day.
other day,
Every other
right?
day, yeah.
All right.
Mhm.
Okay.
All right, so my client is Jinju. She's 20 years old with weak elbow extensors. So we're going to be working with weights to increase the strength in her triceps. It's going to be an eccentric movement, and hello. Hi, I'm Angelica. You remember me?
Yeah, I remember you.
Okay. So, do you know what we're doing today?
I'm not sure.
No? Okay.
Yeah.
So just have a seat. So what we're doing today is a triceps exercise. You've heard of the triceps, right?
Yeah.
Yeah, the muscles back here.
Okay.
The group is called the elbow extensors, but just for you, I'm just call it the triceps, okay? Just keep everything simple. Now, I read on your chart that you have weak triceps.
Yeah.
So what we're going to be doing today is just using a weight like this, 5-pound weight. You want to hold that and see if it's okay? Is that okay with you?
Okay.
Alright, so we're going to be using that in an exercise in an attempt to increase the strength of your triceps. This will help you get up out of chairs easier, just general lifting yourself up out of things sort of activities, you know, along with a couple other things. Risks would be of this exercise is of course just pain, you know. But you should tell me if you have any pain, and we'll stop and we'll try to see what we can do. We're gonna make sure that we don't get to that point of pain. Okay? All right. So, since I know that you're a visual learner, I'm going to just demonstrate this. Okay? Basically, oh, do you have any questions before we start?
I think no, it's okay.
Yeah?
Yeah.
Okay. And so far you've been understanding what I'm saying?
Yeah, sure.
I've cleared the area. We should be safe. There's nothing on the floor. You should be okay. You're okay. You're okay in that chair?
Yeah.
Yeah?
I'm good.
Okay. So, to start this exercise, I'm going to need you to raise your arms above your head, okay? And then slowly bring the dumbbell behind you.
Okay.
Try to keep it in between your shoulder blades.
Okay.
And then back up. Okay? Okay. You understood that?
Can you do it one more time?
Yeah? Okay. Back straight. Down. And then back up.
Okay.
Okay.
Okay. Good.
Do you have any questions?
No.
No?
Yeah.
Okay. Okay. You can try that. I'll watch.
Okay.
Okay. I'm going to stop you right now.
Yep.
It looks as if you're leaning back a bit, okay?
Yeah.
So try to keep your back straight.
Okay.
There you go. Yeah, that looks good.
How about the neck?
Your neck?
Yeah.
Yep, your neck is fine. It's straight.
Mm-hmm.
And you're keeping your head up.
Yep.
Your back is straight. Your legs are a good width apart, so it's good. How does that feel?
Oh, it's good.
Yeah?
I have
No
no
pain?
pain. Yeah.
Yeah. I'll take that from you.
Yep.
Okay. Do you have weights at home?
Yeah.
Yeah. Okay. So here's a sheet of the exercise. Okay. It has how many you need to do there. It has the instructions and a nice picture for you.
That's good. Yeah.
Okay.
Really good. Yeah.
So you're okay to be here. I'm going to leave now, and the PT will come and talk to you more about the exercise.
Sure.
All right.
Okay.
Nice seeing you.
See you. This is my client Ginger. She's 20 years old, young athlete. She had a patellofemoral pain syndrome. So today I'm gonna teach her some exercise, isometric exercise to work on her hip adductor. Hi Ginger, how are you today? I'm Lulu. Do you remember me from last week, right?
Sure.
Yeah. So today your PT asked me to teach you some exercise. It's called ball squeeze exercise. So it's gonna help you to strengthen the muscle inside of your thigh.
Okay.
All right. For doing this exercise, you can get your muscle more stronger, so you can feel less pain on your knee. But the risk is for this exercise, if you do not do it correctly or you try too hard, you might feel pain. So during the exercise or after the exercise, let me know when you feel pain. We will stop right there.
Okay.
All right?
Sounds good.
Sounds good? All right. Do you think you can do the exercise today?
Yeah.
Perfect. So based on your questionnaire, you are a visual and audio learner. So I'm going to demonstrate you while I'm telling you the instruction. So as what I said, it's really easy. You can just bring at home. You can bring a ball or pillow between your knee and then just squeeze it.
Okay.
It sounds easy?
Yeah, I think simple.
All right. I'm going to demonstrate you how to do the exercise. Before the exercise, I'm going to check the brake is on. Perfect. Everything is clear, safety enough. So when you're at home, do the same thing. Make sure the area is safety.
Okay.
Right? So very easy. You can just stand on your bed. Stand upright. Place the ball between your two legs, and while you squeeze the ball, put your hands on the back, kind of like support you, right? So just squeeze and hold that for 5 to 10 seconds.
Okay.
All right, and release. All right, squeeze. For this muscle, you might not see any joint movement. I don't want to see any joint movement, but you can feel your inside of your thigh is working, it's tightening. Okay? If you touch it, you can feel the tightening. So that's give you the feedback how this exercise works.
Okay.
All right, so just like that, very easy. Right? Release and squeeze again and release. Do you think you can do that?
Yeah.
Okay.
I can try.
Can you show me how you can do that before I send you home?
Okay.
All
So
right.
I can sit it there and.
You can sit a little bit. Perfect. Okay, can you do that? Oh, you're back.
Oh, okay.
As what I said, I saw you moving your legs. So as what I said, we're trying to focus on the muscle inside of your thigh. So I don't want to see any like doing that. So when you squeeze the ball, try to make your thigh and your leg in one line.
Okay.
Yeah. So is that good? So
Sure.
Do you think you can do that? Perfect. So we're gonna do 2 sets for me to show you if you're okay to do that. Okay?
Yep.
Okay. 1, 2, 3, 4, 5. Squeeze. And
Okay.
then squeeze 1, 2, 3, 4, 5. Release. Good. Squeeze. 1, 2, 3, 4, 5. Good. Release. All right. One more. The last one. 1, 2, 3, 4, 5. Do you feel any pain during exercise?
No pain.
So do you feel it works for the muscle right here?
Yeah, I can feel something here.
Right here or right here? We're supposed to feel
inner,
inside. Yep.
yeah.
Perfect. So that's everything for today. Do you have any questions about this exercise? Do you think you can do it at home?
Yeah, I can do that.
Perfect. So here's the sheet with the picture and also the instruction.
Okay.
So I want you to go home and do that exercise, only doing every other day. You can do 5 to 10 times for squeezing, and then, 5 to 10 repetitions, 3 times to 5 times a day. Right? As long
And
as
how
you-
many seconds I can hold?
5 to 10
5 to
seconds.
10 seconds.
5 to 10 seconds. It's like make it clear. Make sure when you do the exercise, as well as that, it's not a big movement. You can't see too much of the movement. All right. So you just feel the muscle working. So that will work. That will help you to get stronger.
Okay.
All right. So I'm gonna leave you alone. Are you comfortable sitting there by yourself?
Sure.
All right. Perfect. I'll see you next time then.
Okay.
I'm Nurul. Today, my client name is Ginger. She is 19 years old volleyball player. She had ACL reconstruction 3 months ago. So today I'm going to teach her some plyometric exercise. We're going to focus on the lower extremity, the muscle quadriceps. Hi, Ginger. How are you doing today?
Good.
Yeah, you look good today. I'm Nurul. Do you remember me from last week?
Yeah.
Perfect. So today your PT asked me to teach you an exercise. It's called plyometric exercise. So pretty much we are trying to work on the muscle in front of your thigh. So by doing this exercise, your muscle can be stronger and also react more quickly.
Sure.
All right. So the only risk for this exercise is if you do it wrong, you're not working the right muscle, and then you won't get you won't hit the goal that you want to hit. So, do you think you can do the exercise with me today?
Yeah, I have no pain. I'm good.
You're good. Perfect. So I'm gonna briefly tell you what we're gonna do for today. So we're gonna do the hurdle jump. It's really easy. So you're gonna play 3 bars or tape strike on the floor, and it will be 60 centimeters away. And then you can just squat and jump, do it really quickly.
Okay.
And do you have any questions about
No
the
question.
exercise?
No.
So based on your questionnaire, you are a visual and an audio learner. So later I'm gonna demonstrate you why I tell you the instruction.
Okay.
So we can work it out for the exercise.
Good.
Sounds good? Yeah. All right. So when you jump, I'm trying to bring your heel touch your butt. Okay. So make sure you squat and jump. Squat, jump. Kind of like that. You can pause right here, but not pause between this movement. All right? Is that make it clear? So squat, jump, all right? So I'm not strong enough. I'm sure you're athletic, so you can do it. Do you think you can do that? Okay. So first of all, we're gonna practice your squat. Okay, can you squat for me? Oh, that's what I said. Your knees have to be over your second toes. Don't over that. So over, which means just right above it, not like. Good, perfect. So squat and jump. Make sure to do that. And then when you jump, just try to bring your heel up to your butt. Right? Can you do that? Jump. Yep. Squat, jump. Okay. So I saw you do the squat and jump at the first jump, but the second jump and the third jump, you did not do that. So make sure you squat and jump right here, and you can pause right here, but make sure you have the squat, jump, not too fast. All right?
So how
The
many
key
times?
point is too fast. So can you show me 3 times?
Sure.
All right?
I'm standing.
Should I do it?
So doing.
Yeah. All right. It's really good. Do you think you can do it at home?
Yeah, I can practice.
All right. So here's the picture with the instruction. So you're gonna do that at home. So do that. Try to do that 10 times. 3 repetitions,
Sure.
and only do this exercise every other day.
Every other day.
If you feel tired, just stop the exercise. You don't necessarily to do 10. Just try to do 10.
Okay.
All right. So do you think I can leave you alone right here? Do you feel comfortable?
I have a question. I have to do faster, right?
Yeah, it's the point is key point is to faster, especially when you're squat and jump. This position,
Okay.
we try to help your muscle work faster and quick. Boom. So you as you know you play volleyball, you want to
Yeah.
jump as fast as you.
Sure.
All right.
Okay, that's good.